Hi everybody, I am Monica Crowley. Welcome to another hour of the Strategy Room. We are an interactive show, as you all know. We love to hear from you, so please be sure to send your emails to us, fast and furious, at strategyroom@foxnews.com, strategyroom@foxnews.com. They come right to me. We look at all of them, and we'll put the best ones on the air. So shoot us an email, either based on what we're talking about here on the panel, or maybe what's on your mind. Again, strategyroom@foxnews.com. All right, let me introduce my great panel with me today. To my immediate right, this beauty next to me. Look at how adorable she is. That's Alicia DeGrossa. She is the events chair of the New York Young Republican Club. Welcome back, Alicia. Nice to see you. To her right, we have Dr. David Tukey. Did I pronounce that right?
That's right.
Dr. David Tukey is an NYU neuroscientist. Smarty pants over here on the panel. David also worked on McCain's 2008 presidential campaign here in New York State, David?
Yeah, I ran New York and New Jersey.
Fantastic. Welcome. Also, you are working with, I guess, a draft Larry Kudlow campaign.
We're doing our best.
To get Larry Kudlow to
trying
run
to get his attention.
Chuck Schumer for the U.S. Senate in New York. The website there is draftkudlow.com. We'll talk a little bit about that. To his right, we've got Mark Levine, constitutional attorney, who was also on O'Reilly right before me last night. We can talk about that too. And to Mark's right, we have got Joe Slakis, who is a Democratic political consultant and fundraiser. Guys, welcome. We got to hit a quick break here. When we come back, we're going to talk about health care. More on the other side. Sit tight. All right, here we go. Welcome back. Now, just to apprise you of what's happening, at 1:45 p.m. Eastern Time, President Obama is scheduled to give a statement about health care reform, where his proposal is, where the other bills are, and I guess he's going to give us a roadmap of where he would like to see this thing proceed. So if he arrives on time at 1:45, and that's a big if, we will be taking the president's statement live here on Strategy Room. In the meantime, let me ask you, just as a general proposition, because I was coming upstairs today and I was thinking, what am I going to talk about on Strategy Room? Oh yeah, healthcare. This is like the default issue, and it has been for the last year. And just before we get into the particulars of this, how sick of talking about healthcare are you guys? Because I am up to my eyeballs. Alicia?
I'm past it. Like
over it.
Oh gosh, it was interesting in the beginning, and now I'm done.
Okay. Are you over it? And you're a doctor, David.
Yeah,
you're a medical doctor or a PhD?
I'm a PhD. I work at NYU Medical Center, and I'm over it because there's just never been a substantive talk about any of the issues that are actually going to reduce costs. Finally, he's paying lip service to medical malpractice reform, and saying it should be a state's initiatives. But we should have had this conversation many months ago when we were actually designing the bill.
Just as a pure boredom factor, Mark, without getting into the specifics of tort reform and all of the rest of it, just as a strict boredom thing, aren't you just
I'm ready for this to be passed already. We spent a whole year debating it at length. Republicans said they want to start over again. So Republicans want 3 more years of this. I say we've had our year of discussion. Time to put it to a majority vote.
We're saying we're over it. We want it killed. Joe, are you just bored of this whole thing? I mean, be honest.
Looking forward to Easter when this has been passed.
Oh, when it's passed, yeah. Well,
majority vote.
Now let's talk about
the
president's strategy here, if there is one. Now, what he announced last week, he put out a new proposal, right? By my count, this is his 825th proposal between his ideas and the Democrats' ideas. I'm being facetious here, but I don't think I'm that far off. So the Democrats have had all of these different incarnations of what they wanted to do. First, they were ultimately for single payer, and then a public option, and then that went away, and then it was exchanges, and then it has just been an absolute cluster mess, to be diplomatic about it.
It's moved steadily to the right, steadily to the middle, trying to get Republicans on board. He announced 4 new initiatives today to bring Republicans on board. Republicans said, you can do everything we want you to do, we'll still say no.
None of those things ameliorate all of the other bad things in this bill. He hasn't taken out any of the bad stuff in the bill.
What's bad in this bill, Monica?
Let's talk about the cost.
We can't pay for it.
He's proposing
a new,
smaller version, but the cost is still $1 trillion over 10 years. Explain that to me.
It still saves money. That's the important thing.
The Republicans at the summit meeting, the Republicans, Cantor and Bonner agreed the Congressional Budget Office numbers are right. So
First of
if
all,
you're going to
but
accept
wait a
that, if you're going to accept that, if you're not going to accept that, then
hold on. On the
what's
president's
point of talking?
proposal, though, there are no. It's just a wild guess, right? A little under $1 trillion because there's no legislative language attached to the president's proposal. So the CBO has said we can't even score this. We have no idea what this is going to cost.
The point is, we spent trillions on wars we didn't know were going to cost anything, the Iraq War and everything else. We spent trillions on Bush's tax cut. Now this will save us money, and the question is, how much will it save us? Will it save us $1 trillion? Will it save us $700 billion? This helps the budget. On a pure fiscal conservative notion, you should support it.
I got to tell you, I got to bat back those 2 points. First of all, on the Iraq War, we have national elections coming up this weekend in Iraq. Even Newsweek's cover story this week says Iraq has been transformed.
But were you willing to pay taxes to pay for Iraq?
Yes,
no.
I supported the Iraq War.
You supported an increase in taxes.
But you haven't paid any.
Wait, you support an increase in taxes.
Let me
All right,
just,
I just want to get that on the record. Monica supports an increase in taxes.
Flourishing Iraq representative democracy there actually was an outstanding investment. And number two, the Bush tax cuts gave us 53 consecutive months of job creation and economic growth.
Gave us massive deficits. Now, if you're fiscal conservative,
I'm
glad to hear that you were willing to raise taxes.
There were other things
Very
that
few
gave us
Republicans
deficits.
were, by the way.
No, I'm not talking about raising taxes.
To pay for the Iraq War, you agree that we should have raised taxes.
No, Bush cut taxes. He didn't raise taxes.
No, but you agree that to pay for the Iraq War, we should have raised taxes to pay for it rather than go into massive deficit, right?
No,
So you believe in the deficit?
I said, so hang on, Mark. I do not believe in the deficit.
Well, my question is, do you agree
There's
that...
something called the Laffer curve.
Do you agree in paying for the Iraq War or not?
There's something called the law of tax cuts. Law of tax cuts. You cut taxes, you actually get more revenue into the United States Treasury.
That's not true, and you know it, Monica.
JFK did it.
JFK lowered it from 90% to 70%. Right now, rates are higher than they are lower than they were with Ronald Reagan.
He did that when JFK did that marginal reduction in the tax rate, guess what happened? More revenue.
Monica, I'll make you a deal. I will not support raising taxes over 70%, but it didn't work with Bush and it didn't work with Reagan.
We're talking about apples and oranges, guys, and I want to give
you overspent what was coming in. He put it all on a credit card, and now we've got the bill.
Hang on. Talking about apples and oranges, national security versus a domestic policy.
But that's my point.
Money.
Republicans aren't willing to pay for health care for Americans, but they want to go into massive debt to pay for a war that we didn't need to fight.
And I want to give my Republican friends here a chance. That is not true. What the Republicans are saying is you do not have to remake the entire healthcare system and spend $1 trillion or $2 trillion in order to do the reforms that are necessary. David, you're a PhD, you're a neuroscientist at NYU. I want you to give us your professional opinion about the Democrats' plan and what you would like to see done in terms of reform.
Well, there are very basic things that can be done that will reduce costs that don't cost $1 trillion. For one, finally someone's paying some attention to the idea of letting healthcare being bought across state lines. There's no reason that the average person in New Jersey should be paying 9 times as much as the average person in Kentucky. You allow people to buy health care across state lines, you inject some competition in the market, immediately you see costs start to come down. 2, medical malpractice reform. The idea that defensive medicine is increasing costs by 10% across the country is something that's very dangerous, and we need to change the culture of medicine. It starts with doctors being able to prescribe the treatments they know are best, not the ones that are most conservative. So those are 2 things, and I can go on.
I'd like to respond to both of those, but go ahead, Alyssa.
Oh, well, even after the last show, we were discussing about preventing infectious diseases in the hospitals. You go in.
We each had a very nice discussion where Alicia came to something we agreed on, Republican and Democrat. I'll have you know. Go ahead, tell them.
We agreed on. What happens a lot is you go in for one thing, and then you get an infectious disease while you're in there. You get bed sores. Your bed sores get infected, and you either die or stay in the hospital for an extra 2 weeks. And these things are what are growing costs in healthcare. If we were able to put some kind of we don't necessarily have to legislate, but in some kind of way to lower this and put safeguards in so people aren't getting infections in hospitals, we would lower costs by millions and millions and millions of dollars.
All right, let me just jump in with a couple of emails. Sure, I'll let you.
Yeah.
Dan says, does the good doctor consider liberalism a mental disorder? I guess that's for you, David. You don't have to answer that. Let's see. Bob,
my listeners consider conservatism a mental disorder. That's just name calling.
I think that the answer is pretty obvious. Bob, who is a very loyal viewer to the Strategy Room in Phoenix, Arizona, says, the health care bill, hopefully it will be put to death on on Good Friday and not resurrected on Easter like Jesus. So that's very funny.
I want to respond to David's points, though, because
Mark,
of the kinds that Republicans talk about all the time, across state lines and tort reform. Across state lines means a race to the bottom. And let me give you an example. New Jersey, they require someone who's been raped and abused, a victim of domestic violence, to be covered by health care. Mississippi doesn't require it. If you allow New Jersey